Good morning and welcome to Let's Talk. Thank you for joining us for this half hour. Now, let's talk.
And good morning and welcome to it. I'm Tracey Morgan. Nice to have you with us, especially this time of day. It's Monday. We're going to get through the day, right? Don't look at the clock. I said don't look at the clock. It'll just make everything longer. We are here, though, for 30 minutes, and this is a quick half hour when we have these great guests on our show. And today, we're back with Compassionate Certification Centers, and it's always great to have them on because we have a ton of questions about what they're doing right here in town and about medical marijuana and the cards. And so we're going to talk a little bit about what they do. Now, before we do get to our guests, let me remind you of the different ways that you can listen because, of course, you do have us on the radio. Thank you so much for doing that. But you also have the option of the free app that you can put on your smartphone or your cell phone. Or your cell phone, I guess. I don't know. I'm combining words. Pat's laughing at me at this point because I'm combining too many words at the same time. Then we have online at WISR680.com. And then, of course, you have our podcast page on our website that you can listen to this conversation in its entirety once we are all done. Alexa-powered devices also, that's another option for you. You just say, Alexa, play WISR 680. That should be enough. All right, let's get to it. Melonie Kotchey is with us today. And, of course, she co-founded the certification centers, the Compassionate Certification Centers. Melonie, how are you doing today? It's nice to talk to you again. Oh, is Melonie with us? I'm not sure where Melonie went.
She is.
There
Good morning,
she is.
Tracey. I had you on mute. Hello, folks.
There's the big entrance, the big pause. Melonie, so nice to have you with us. It has been a few weeks, but I'm glad you're back because it's interesting when we see the big sign there in downtown Butler on your building, Compassionate Certification Centers. I always enjoy hearing you all, meaning your doctors and yourself, explain what you do because even though this has become familiar with us, the medical marijuana issue, I don't think we really understand what you do inside your building.
I agree with you on that, for sure, Tracey, because if you live in Butler, you usually live anywhere within 2 miles of a plant that makes potato chips, corn chips, pretzels, candy, ice cream, packages of turkey, beans, bologna. So what on earth is a medical cannabis healthcare clinic doing right in downtown Butler? I guess that's your question, huh?
Yeah.
Well, we'll tell all of your listeners about Compassionate Certification Centers. This is something that Dr. Brian Donner and I started. This is a healthcare organization. We're medical cannabis specialists, and we're located at 127 East Cunningham Street. We put our office there because we really wanted to help the community in a number of ways, and we see patients for their medical cannabis cards. We also sell CBD, and we also do CBD consultations.
And your office is really easy to get to because, of course, you have the parking garage right across your street. And,
Yes, it's easy to get to. It's right on 127 East Cunningham. I know a lot of people know that Cresco is one of the few dispensaries in the area. There are 76 more dispensaries opening up over the next year, actually, Tracey. So people are familiar with Pillow Street, but we're across the other side of town. Have a big sign, lots of parking, and there's plenty of retail space. We have a lot of customers that come in and talk to us about CBD and register with the state, register with us to be a patient or purchase some CBD here today.
So, Melonie, let me ask you this question because some notes that are in front of me indicates that you have doctors coming into Butler to serve the people of Butler. Is that the case, or are they doctors that are within the Butler County limits that are working here?
Actually, we have both, Tracey. We have days open when doctors are available. We have quite a few on staff, and some of them rotate in through Butler office because we have 10 different clinics. They span all the way north to Erie, east to Carlisle, and as south as Washington, and everywhere in between. But Butler is one of our busiest offices, and we do bring other doctors in from other areas that work for us, but all from Pennsylvania.
So talk about your doctors, if you will. I know you have quite a few, but generally speaking, who are these doctors? Are they specially trained? How long have they been in the medical marijuana realm of the medical field? I mean, who are your doctors, generally speaking?
Most of our doctors are emergency room physicians who are partially retired or fully retired. I like emergency room physicians because they've seen everything and everyone under the sun, from children to older folks, and that's what we see in medical cannabis, too. We see everything and everyone under the sun, So it's a nice fit. We do have a number of other specialists as well, like an endocrinologist, an OBGYN, and a primary care physician. But most of our doctors are emergency room physicians, and they love to talk about opioid use disorder and opioids and getting patients off of them and onto medical cannabis is really a nice goal of ours that we have had being in the Butler area. We're also in Clarion and Kittanning as well.
Do they have to go through special training in order to be licensed to be able to talk medical marijuana with individuals?
Yeah, they do actually, Tracy. That's a good question. They have quite a bit of online, or they could take training a variety of ways they can choose, but the state offers many programs, most of which are online except for one. We also ran the World Medical Cannabis Conference and Expo. Tracy, I don't know if you had a chance to go to that last year or the year before, but we educated upwards of, we had about 4,000 people attend. We did offer the state class, and our physicians have all gone through that as well to be certified to see patients.
So they have continual education classes.
Yeah, and actually our physicians are required to read the Regina Nelson ECT therapy, which is a current book that's out. We also offer all kinds of continuing education classes for our physicians and our nurses and our medical staff. Anybody that touches the patient, talks to the patient, has an opportunity to keep learning about the endocannabinoid system and medical cannabis, and within our organization at Compassionate Certification Centers.
Just some light beach reading, I would say.
Absolutely,
Yeah,
very
right.
light and easy. CBD sometimes can be, but the deeper in depth you want to get in the science, you can, or you can keep it light.
Yeah, and I'm glad that I asked, because the reason is you always wonder about the doctors that you're seeing, because this is relatively new in the way of the medical field, and then it's new to us here in Butler County. I know it's not new as of last week, but still, I think it takes us some time to understand all the different pieces of the puzzle with medical marijuana and compassionate certification centers. So it's nice to be able to be comforted by going in and knowing that your doctors have been doctors for quite some time.
I love our doctors, Tracy. They don't judge. I personally met and hired all of them. I like them very much. I've met a lot of doctors in my lifetime, being in the medical field for 25 years. And our doctors honestly treat our patients so well. It makes me so proud and smile when I see them, getting them a cup of coffee in the waiting room, or just going the extra mile to help them get registered with the Department of Health is so nice to see. It's judgment-free zone at our office everywhere you go, and you don't see that very many places, especially if you've ever been to a pain clinic. Those poor people, and I've been to one myself, understand what I'm talking about.
Absolutely. Melonie, I want to change directions just a little bit in our conversation. Of course, Melonie Kotchey is with us, Compassionate Certification Centers right here in downtown Butler. And I want to get your viewpoint, if you would, on the opioid situation, the drug problems here in Butler County. That topic has really been a hot topic for the past handful of years. And so I'm just wondering, since you are now in Butler, do you have any connection with that issue? Do you help in some way, and how do you help?
I'm so glad you asked. And it's a subject that has been broached so many times. We do know that Pennsylvania saw an 81% spike in the number of suspected opioid overdoses coming into our emergency rooms, where our emergency room doctors work. And that's according to the CDC studies from 2016 through 2018 of September. So it's estimated that there's roughly 4,600 Pennsylvanians who have died just from opioid overdoses in that span of time. That's about 13 people a day, Tracy. So state health officials say that opioid overdose reversal drug Narcan, they look at that as a vital role. In April 2015, physician general Dr. Rachel Levine, she signed a standing order prescription for first responders so anyone could get that life-saving drug. But more and more police departments are equipping officers with antidotes and nasal sprays. But I just want to go over real quickly a couple of statistics with you, Tracy. They're really interesting. Like, for example, Butler County had 3.2 deaths per 10,000, overdoses per 10,000 residents. Basically 3 overdoses per 10,000. Now, just to give you some perspective, Armstrong County was slightly higher, and Erie was a little higher than that. And that's a little bit high for me. The total reversals when we talk about Narcan being used was 60 in Butler, 23 in Armstrong, and 110 in Erie, just to give you some perspective on the opioid problem. And honestly, what we're doing to help that problem is we're helping patients transition off of opioids, which currently there were only 4 FDA-approved ways of doing that, and getting their medical cannabis card. And I can talk to you a little bit about what those numbers look like, what the success rate is for patients getting off of opioids and the reduction in pain and getting, getting themselves to the point where they don't even have to take medicine or better at all.
Yeah, I'd like to hear the stats because the stats that you just gave seems to be that I'm glad that we're lower than the other areas, but yet, like you said, it's still high.
It is, and we're excited because we know that by the time we compile all of our data, we've already seen in the last year and a half patients are coming back opioid-free or reduced opioids. And that's what we're seeing clinically, and now we're going to be able to put that data together because we have over 51,000 patients in our database who have signed up to be a patient with us. And that's a lot of patients we can take a look at and see if they're on opioids now and then if they've been decreased over the last year. And what we've seen is that there's a 40 to 60% reduction in overall opioids in the patients who come to see us on pain medication looking to get out of pain. Patients in these studies reported fewer side effects with cannabis than with their opioid pain medications, including like paradoxical improvements in cognitive function, a better quality of life with cannabis use compared to opioids. So, Tracey, despite the vast array of cannabis products and routes used by patients in all states with medical cannabis laws, cannabis has been consistently shown in each state to reduce the opioid dose needed to achieve the pain relief they had before.
So is there a reduce in the craving for the opioids, or again, like you just mentioned, it's reducing the pain, so therefore the other drugs are not needed? What's going on within one system that it's working?
Both, Tracey, because we're hitting actually on two topics. One is pain relief and pain reduction, and the other is complete, discontinuance of opioids. Or there's patients who have opioid addiction problems, and those abstinence-based protocols, those are the ones that are particularly ineffective. So, for example, if a patient doesn't want to be on opioids at all, they have an 85% chance of relapsing within a year of their initial treatment. That doesn't occur with cannabis.
And so this
right
is,
now there's only four prescription medications, Tracey, that could be used as therapy to help patients detox and not relapse. Now medical cannabis is a viable option in Pennsylvania since they added opioid use disorder. So that's really exciting. Patients can come see us, Tracey, if they have chronic pain and they're on pain medication and they just want reduction in pain, or if they want off of their pain medication, or if they become addicted and they have opioid use disorder, they can also see us as well as long as they've failed once. That's the point. And with those three different ideologies and patient populations, we're seeing an overall reduction in opioids we have over the last year and a half. It's very exciting.
If somebody is listening today, maybe they are the ones facing the opioid addiction, or maybe they're a family member. If somebody has not yet come to see you, do they have to come see you for the card first and then go down the route of getting their medications?
Yes, patients need to go to cccregister.com or call us at 888-316-9085, and they can start to get their medical card today. They can stop in an office and purchase CBD today, but the first step is calling us any way they would like to, or getting online or chat line and scheduling an appointment with us. The rest we can take care of.
Melonie Kotchey with us with Compassionate Certification Centers. And I know we're talking about the opioid issue right now, but let's also include some of the different conditions that people have when they come and see you, and that allows them to seek alternative medical care.
Well, PTSD comprises up to 70% of the population. Believe it or not, it's another common condition people get their card for. And it's really composed of how people deal with trauma. And that disorder, it's very difficult to treat. There's a lot of different therapies for it, but cannabis is certainly one of them, and PTSD is approved as a qualifying condition. It's one of the ones that we see a lot of patients for. They may not have the medical records. They might have to go and get them from their doctor or remind their doctor to put it on their records if they've been diagnosed somewhere else. But that is certainly one of the qualifying conditions that we see quite a bit.
What are some other conditions? I know there are quite a few, and we don't have to go through all of them, but just let's mention a few so people get a pretty good idea of what is considered a condition that would be one that you could treat.
Sure. Well, there's different types of neuropathies. I'd say diabetic neuropathy is the one that people don't realize. If you have diabetes, you can get your medical card if you have any type of neuropathic pain. That's a common one that we see, and it's sad because there aren't really any options for that, Tracey. When you have painful feet and legs from any type of neuropathy, if it's diabetic nerve pain, there's really not a lot you can do. We also see quite a bit of addiction substitution therapy, which we talked about, and some autism. Crohn's is one of them. Crohn's is an interesting one because CBD we've just been seeing so many patient testimonials with Crohn's being so positive, regulating the systems. And epilepsy, of course, is another qualifying condition that we see quite a few patients for.
Melonie, I'm going to go back to the neuropathy for a moment because I remember talking to Dr. Donner, of course, with you, and you mentioned him at the beginning of the program. When he was on with us a while ago, he talked about chronic pain. Does that cover neuropathy, or is chronic pain a whole different category?
Well, honestly, this should be under the chronic pain category, but it's one separately out on its own. So chronic pain is one of the conditions. That's pain that's longer than lasting at least 3 months or longer. But neuropathies is actually separately listed as a qualifying condition.
How can people go about finding out if their condition is a condition that you can help with? Is that listed on a website?
That's one of the things that we do all the time. I'm glad you asked. We actually have quite a few ways. If people are online, they can stop at cccregister.com, and there's a chat line, and they can just chat with somebody about their specific condition off the record. Want to ask some questions. We're also on Facebook. We have someone always on there answering questions. They can also call us at the 888-316-9085 number, and somebody can talk to them and even review their medical records and see if they will qualify as much as we can over the phone. But we still have to have them come in, obviously, if they're going to get their medical card. But sure, we have those things available to help patients and answer their questions.
Melonie Kotchey, again, Compassionate Certification Center. So when Melonie throws out the CCC, that's what she's talking about, Compassionate Certification Centers. And, of course, right in downtown Butler. And, Melonie, again, I'm going to switch directions with you. I know we're switching a lot today, but there's something I wanted to ask you about, which is gun laws. And in respect to what you do in the way of medical marijuana, can you take medical marijuana and still own a gun? Are there laws associated with that? What's your opinion on that?
I'm glad you asked. It's one of the most common questions that come up. We hear it all the time. I'm not getting my medical card because I'll lose my guns. Simply not true. Thank you for asking. Yes, you can get your medical card and own a gun. Yes, we are allowed to certify you for your medical card if you are a gun owner. State laws do not prohibit you from owning a gun and having a medical card, Tracey. You can also have the option to purchase CBD and not get a card at all. So 4 points real quick. Number one is no PA patient will be forced by the police to surrender their firearms. Pennsylvania law does not prohibit firearm possession for cannabis use. My second point that's important for people to know or pass along to a friend, because I hear this so much, firearm possession is prohibited under federal law, whether the cannabis use is legal or not under state law. So case law shows there's never been a federal prosecution under such a circumstance. That's encouraging. Number three is a registered patient should be able to keep and obtain a concealed carry permit. And number four, a registered patient cannot purchase a new firearm from a federally licensed firearms dealer without lying on the form 4483. That's one of the most important points I want to make to all of our listeners, not to be a fool and think you have to make a choice. Getting your medical card does not mean giving up your gun. Consume cannabis illegally, and then you will have to give up your guns because now you have a criminal record. So it's best to get your card and protect yourself and be a responsible gun owner and medical cannabis user or consumer.
I'm going to go down the road of asking you about drugs, medical marijuana showing up or not showing up on a drug test. And the reason I ask that is because I was in a conversation just in this past week with somebody asking that very question. And of course I'm going, I think I know the answer, but I'm not sure. But I think I'm a very normal listener to you because it is so new to us. So I have to ask you again, can you explain to us CBD oil, CBD, medical marijuana, does it show up on drug tests for jobs and other tests that we would need to take or no?
Okay, so THC in your system would show up on a 10-panel urine drug screen if a patient were to take a drug screen. A CBD is short for cannabidiol. That's the molecule found in the cannabis plant. While CBD is often positioned as a miraculous cure-all, capable of treating of everything from anxiety to back pain, the vast majority of people don't fully understand what it is or even how it works. So unlike THC, the other crucial component in hemp, which would show up in your drug screen, our CBD would not show up in your drug screen. It doesn't produce the psychoactive effects that make you feel high. Instead, thousands of our patient testimonials you can read, and my own is actually this. It eases anxiety and makes me feel less high, or our patients feel less high. In other words, CBD is ideal for people. It doesn't show up on a urine drug screen. THC would. We have had that happen with patients, and if they have their medical card, they're in a far better position with their employer than if they had not.
Have you ever had somebody take, whether it be CBD oil or medical marijuana in some form, and they had, I don't want to say a negative reaction, but a reaction that they weren't comfortable with, so they wanted to switch out to something else?
We have not had a negative reaction. We've had people that don't like the taste of some of the different types of CBD over many years of doing this. I can't say that everybody's liked it. There's so many different formulations. That's why we offer pills, tinctures, sublingual, and even some really great muscle creams, I have to tell you, that work really well. Does that answer your question, Tracey?
It does, because it's just interesting when I talk to you at Compassionate Certification Centers. It seems like, everybody can take this and nobody has an adverse reaction. And I just wondered if that does indeed happen.
CBD is the most safe supplement medicine. I'm not sure which it is at this point in time. It gets recategorized almost every day.
Terminology changes all the time, right? So we can find out more about that. And folks, if you want to call Compassionate Certification Centers, please do. Again, look them up online. Ask Alexa how you get to the location in downtown Butler if you'd like. It's Compassionate Certification Centers, and they can lead you in the right direction and answer all your questions. And Melonie, let me ask you, though, what is your goal for being in downtown Butler? You mentioned that you have many different locations with Compassionate Certification Centers, but you have been in Butler County, right in downtown Butler, for a little bit of time now. What's your goal? What are you hoping to achieve?
Well, actually, myself and Dr. Donner are both from the area. We're not born and raised from Butler, but we both have a love for the area. Let me tell you, we just really do love helping people, and that's the goal, is reducing and helping patients who are in pain. Tracey, find relief. Stop the drug problem as much as we can and help, even if it's just one person a day, help them get out of pain. That may mean stopping this show, calling us, coming in to any one of our 10 welcoming offices. We just want to change the way healthcare has been for so long. So our listeners often need information on the latest options in their community and what services are there. We just want to be a nice resource for everybody in the community to go to.
And does it take a couple of appointments to really start understanding this information? Because, again, if it's something that I'm unfamiliar with, I don't even know what I don't know to even ask you. I don't even know where to start with this. So what do you tell people when they're very unfamiliar, so they may be very uncomfortable about coming in?
Oh, Tracey, you make me smile. When I first got my medical card many years ago in another state where I lived, I felt the same way. I had the same anxiety, the same questions. I didn't know what to do. And it's what's inspired me to really, I don't want to say dumb things down, but I'm going to, because I feel you. People don't know what to do, and it's really, really simple. I made it simple on purpose because I had such a hard time myself as a patient. You just call us, and we'll walk you through it. That's it. You can stop in an office or call us. That's as simple as that. We'll get your medical records. You'll have to come in and see a physician. Most patients get certified. We recertify you a year later. And in between that year, Tracey, we offer 5 layers of care. And if you have time this time, we'll get into it. And if not, come back on another day and talk to our listeners about different layers of care that a medical cannabis organization like Compassionate Certification Centers offers.
Let me ask you this. How the information that's out there, I'll just say it's a noisy world. It's a busy world. How important is it that we come to professionals? Because not everybody sells, CBD oil, but it just seems like every time we turn around, there's a new organization selling it, or there's a new website for it, and then there's a new name for it, and it just keeps on going. So how important is it that we come into Compassionate Certification Centers to learn what is good for us, what's not?
Well, if you want to take something that you don't want what you're taking, you should definitely buy it somewhere else. Otherwise, when you come to us, you'll know what you're getting. That's the point I'm trying to make. We lab test our CBD 3 times. When you go into a head shop or a vape store or any other clinic, if they don't have lab reports that show you the full profile, then you don't know what's in it. And I have to say, I bought stuff from Walmart. I purchased CBD from Costco. I purchased it at a vape shop, and I know there's nothing in it because I sent it to a lab. So I don't trust anything. I trust our brand. It's from a doctor's office, and we pay a lot of money to have it lab tested so we know exactly what you're getting. That's the difference, Tracy, is you don't want to take something that could have THC in it. If it's not lab tested and you need to be on THC free, you might take CBD and you might test positive on a urine drug screen. If you buy ours, you know for certain that you won't.
Let's get your phone number and website again, and then I have a couple more questions for you before we go.
Sure. Our name is Compassionate Certification Centers. You can notice us by the American flag with a pink leaf and the cannabis leaf.
Can't miss the picture.
888-316-9085. Sorry, Tracy, I'm laughing. And also our website is cccregister.com.
Yeah, it's a great, I compliment you. I know I joke about that logo of yours being so big, but you can't have better advertising than that. When you come down the street, you see it immediately. And I love that you've done that. I think it's a great thing.
Well, Tracy, I do have a marketing background. I sure hope so. I do like the logo, and the flag keeps us remembered. There's a lot of people out there trying to copy what we're doing, but there's only one Compassionate Certification Center.
Absolutely. Before you go, let me ask you about your other services. I know we keep talking CBD and medical marijuana, but what other things do you do?
Well, we offer 5 layers of care. We keep building this out as we get better and better over the years. So the first layer is just taking that first step of getting your card. And it's just as simple as registering with us online or calling. The next is getting your medical card, which would mean you have to come in and offer a time to come back in a year. Just come in and see us once a year for your medical card. You also have the option to have a CBD consultation, and you also get to see our entire line of products, dosage, and strength. The third layer is concierge care, Tracy, which this is access to a nurse full-time. It's an extra layer of care for you and your family. We find a lot of families with children like this concierge care. They feel at ease. Once they get their medical card and leave the dispensary, we don't just let you go. I mean, if you want to call us and certify and schedule another appointment, that's wonderful. It's just another layer of care. We're there for our patients. And we also offer support by emails, our company and conventions, and so many events. Like we were just at the Jeep Festival over the weekend supporting the local events. We had a grand opening and a big town hall show out at that event. So it's really nice to see that we offer this layer of care for our patients as well.
So you have 5 different layers. Again, if we need to talk to Compassionate Certification Centers, I know we can talk to you. We can ask Alexa where you are. But again, give us your address, your phone number, and also that website that we can look you up.
Sure. Alexis won't listen to me. My husband disabled her for me to use, so I can't even have that option. You guys are very lucky. This is beyond what most doctors will do is what we do because we care so much about our patients.
So let's get the website and your phone number. That'd be great.
Yes, it's Compassionate Certification Centers, cccregister.com, 888-316-9085. You can push option 1 to schedule, or 2 if you want to register with the Department of Health, 3 to leave a message.
Absolutely. Compassionate Certification Centers, Melonie Kotchey, thank you so much. We always appreciate you stopping by.
Thanks, Tracey. Have a great day, everybody.
Thanks. And folks, you can listen to this in its entirety once again on our website. You go WISR680.com. So you're going to pick programs, then Let's Talk, and then look for that folder, if you will, that says Compassionate Certification Centers. I'm Tracey Morgan with Let's Talk. Have a great day.
The information and opinions shared on this program are solely those of our guests and do not necessarily represent those of WISR, the Butler County Radio Network, or its staff and employees.